Viewers, a big Republic business news break coming in. Bengaluru-based healthcare provider Narayana Health has now announced the acquisition of UK-based Practice Plus Group hospitals for £188.78 million, acquiring about 100% stake of 60,001 equity shares. It's said in a regulatory filing. Now the acquisition represents Narayana Health's move into the UK healthcare market, where the PPG operates 12 hospitals and surgical centres, specialising in high-quality orthopedics and general surgery, among others. The strategic acquisition extends into Narayana Health's global reach, placing the company amongst the top 3 healthcare providers in India by revenue. And for more, we're being joined by my colleague. I think we have Pranav live with us. Let's go to Pranav if you have Pranav live. Pranav, huge update coming in because this is a major acquisition and a very strategic acquisition which has taken place.
Well, absolutely. In fact, this is just, another example of how Indian-made, homegrown brands are, in fact, expanding their global footprints. We've already seen a number of Indian majors acquiring stakes in global giants. And here's Narayana Health now acquiring a massive, acquiring UK-based Practice Plus group of hospitals, which conducts 80,000 surgeries every year. So that's a massive development, and it's definitely, just a shot in the arm for the India shining story, wherein we are seeing Indian brands taking over global giants.
Absolutely, Pranav. This is a huge update and a public business news break that we're getting for our viewers. And also, it's a strategic acquisition extending to the global reach of Narayana Health, placing the company amongst the top 3 healthcare providers in India by revenue. This is what we have come to know so far. And we have also, the Dr. Devi Prasad Shetty, who's a founder and chairman of Narayana Health, has said that the acquisition of Practice Plus Group hospitals and surgical centers is an incredibly exciting step for Narayana Health. And like Narayana Health, Practice Plus Group recognized that the majority of patients were struggling to access healthcare. All right, let's go to Dr. Devi Shetty, who is the founder and chairman of Narayana Health, who's joining us. Dr. Shetty, welcome to Republic TV. This is a strategic acquisition, and it is also helping with the global reach, placing the company amongst the top 3 healthcare providers in India just by revenue.
I want to congratulate my team and mainly our government for supporting us to think big. Yeah. It's a great opportunity for us to make a difference in healthcare in the rest of the world, predominantly because of the expertise we have developed back in India, especially in terms of building a very, very powerful digital tool supported by AI tools, which will have a massive impact. And this is the main agenda for us to go to England.
Mr. Shetty, what is it that you're looking at in terms of the timeline, in terms of the next foreseeable future? How do you think this step will unveil over the next foreseeable few months, sir?
We expect a very positive impact by us participating in the way healthcare is delivered in this group of hospital, Practice Plus group of hospital, mainly because we are a healthcare group who understands how to run healthcare. And we have a very, very powerful digital tool which will bring in a lot of efficiency and a great consumer experience. With the experience of healthcare supported by a very powerful digital tool, can make a huge impact on efficiency, productivity, cost, and customer satisfaction. We believe we have a great opportunity to show what we can do to bring in efficiency in healthcare. Yeah.
Okay. Dr. Shetty, I mean, this is just a very, very proud moment for all of us. In fact, at a time when we're looking at Indian giants expanding the global footprint, how do you see this in view of the overall India growth story, sir? I mean, we're looking at tariffs, we're looking at global headwinds, and at a time like this, we have an Indian giant or an Indian company like you, which is setting its footprint in the UK. How do you see this in the larger view of scheme of things, sir?
all it shows is that there is a great opportunity in India, of course, equally good opportunity outside India. And like us, many more hospital groups and many more other industries will start looking outside India. We are essentially the attitude of most of us 20, 30 years ago was to build everything in India. But our government policies and the encouragement they have given us to expand our services outside India had a major impact on the way we have developed. We built a large hospital in Caribbean, in Cayman Island, 12 years ago, and now we have gone to England, and it is just the beginning. Like us, many more will venture out, and this will be a new beginning in terms of earlier we were dominating, we were very good in delivering software. Now we have a great opportunity in service sector as well, in Europe and rest of the world.
After having served in India, I mean, after having, grown the brand in India, what do you think are certain changes, certain headwinds that you will be facing in a global market such as the UK?
See, I'm a product of National Health Service of England. Today, whatever I am today is because of the NHS. They gave me the training, they gave me whatever I needed, they looked after my family, and I know how the British system of healthcare runs, and we know our strengths. I think an Indian hospital group in Britain will make quite a big difference to the way people experience healthcare.
You've talked about affordable healthcare at a time when, especially in the West where healthcare costs are extremely high. How do you think a global, an Indian brand like yours will make a difference in terms of bringing the cost of healthcare down for a common man in the West probably?
See, the healthcare is all about economy of scale, efficiency, productivity. Like you buy a CT scan can do 200 CT scans per day. But if you do only about 20 CT scans, which is usually done in a lot of the hospitals, the 180 CT scans perish by 7 o'clock in the evening. Similarly, the operating room facility. In India, because of the frugality, we are very much used to improving our productivity by using the infrastructure long hours and various other technological tools which will help us to be efficient. Like the entire doctor's mundane work of documenting everything is now done so seamlessly with all the AI tools. And we took 20 years in developing these tools, and the expertise what we have in treating thousands and thousands of patients in India, supported by the digital tools, will have a big impact on the way efficiency can be brought into the Western hospitals.
Okay. This one's a purely investment or investor-centric question. So, what are the kind of numbers that you're looking at? What is the kind of what is the kind of guidance that you're looking at? Investments that you're looking at over the next about a few months?
I think about the financial aspect of our investment, I should ask our CEO to answer. But from the medical point of view, I can say that it's good for us, good for our company, good for England, and good for English patients.
Wonderful. Dr. Shetty, that's indeed a great development and yet another story unveiling in front of us wherein we are seeing a homegrown brand increasing its footprints in the West.
Thank you. Thank you so much. Thank you.
Well, thank you, Pranav and Dr. Shetty, for joining us there. Let's move ahead, viewers, to some of the other stories we're tracking.